Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, a report presented at the Alzheimer's Association International Conference on July 20th, 2017, and simultaneously published in The Lancet 2017, showed that 9 lifestyle factors are responsible for 35% of all dementia cases worldwide. So 9 lifestyle factors, things we have control of, account for 35% of all the cases of dementia when you look at global statistics. So what are the 9 factors that increase the risk of dementia that are lifestyle related? Well, number 1, not completing secondary education early in life. Number 2, having high blood pressure, especially if it's not controlled. Obesity in midlife, as people gain weight as they get older, it increases risk. Hearing loss in midlife is related. Smoking increases risk. Depression increases risk of dementia. Physical inactivity. When you exercise, when you're more physically active, it helps to reduce risk. Social isolation. And developing diabetes later in life. So this would be developing type 2 diabetes as you get older, usually related to gaining weight and being physically inactive. So this study was not able to include dietary factors or a look at alcohol use or visual impairment or air pollution or sleep practices. So the researchers concluded that the contribution of lifestyle factors is probably quite a bit higher than just 35% when it comes to cases of dementia, because dietary factors, specific ones, really make a difference, as well as sleep quality and sleep duration and other factors. But with respect to the influence of specific nutrients on cognitive function, quite coincidentally, a scientific review of the top ingredients for cognition and focus and mood was published on July 14th, 2017, so the same month that the Alzheimer's conference was going on. NutriIngredientsUSA.com published this amazing review paper on the role of specific nutrients and cognitive function. So the review highlights the research showing evidence that the following nutrients help to preserve memory and focus, and some nutrients can even help to improve mood. So for instance, a 2015 meta-analysis showed clear benefits of omega-3 fat consumption to cognitive health, and a clinical trial showing that daily DHA doses over 1 gram a day, 1,000 milligrams a day, improves some aspects of cognitive function in older patients. So DHA is one of the omega-3 fats that's found in fish. It's docosahexaenoic acid. It's one of the essential oils that's found in fish. And fish oil, it's an omega-3 fat. As well, some studies have shown that omega-3 fat supplementation is also a good complement to drug therapy in the treatment of depression. Omega-3 fats help to improve receptor function in the brain so that the drugs actually work better. Now, the supplement known as Phosphatidylserine is also of interest, as some studies have shown it benefits dementia or cognitive dysfunction in the elderly. So phosphatidylserine is a phospholipid. It's in the cell membrane of brain cells, and it's very important for normal nerve cell transmission and to help make the memory chemical acetylcholine. And supplementation with phosphatidylserine in some preliminary studies have shown benefit, especially with cognitive decline that occurs as people get older. So in the United States, the FDA allows this statement for phosphatidylserine supplements. It says, you're allowed to say this on the label, very limited and preliminary scientific research suggests that phosphatidylserine may reduce the risk of dementia and cognitive dysfunction in the elderly. Now, along the same lines, there's also a supplement called CDP choline that has shown an ability to reverse early stage cognitive decline as well by increasing brain levels of choline. As you get older, it's harder to get choline into the brain, and CDP choline helps to get choline into the brain and helps the brain then take that choline and convert it into the memory chemical known as acetylcholine, and that because those levels typically decline as we get older. So CDP choline and phosphatidylserine show a lot of promise in helping to preserve choline and acetylcholine levels in the brain as we age, and that's very important to maintain memory. Now, B vitamin supplementation, especially folic acid, vitamin B12, vitamin B6, and vitamin B3, which is niacin, have been shown to benefit brain health in some studies and to slow age-related shrinking or atrophy of the brain. Now, some of these B vitamins, folic acid, B6, and B12, also lower homocysteine, and homocysteine is known to damage the brain and be linked to Alzheimer's disease. So lowering that homocysteine with these B vitamins seems to be highly beneficial in keeping that homocysteine level lower, because homocysteine level damages the brain and it's linked to Alzheimer's disease. Some studies also show that supplementation with antioxidants, vitamin C and vitamin E, may also help to reduce risk of cognitive impairment. And more recently, nutrients like lutein and magnesium have shown promise in preventing age-related cognitive decline as well. Those studies are very preliminary. Now, in India, a common treatment for early-stage memory loss is the herb known as Bacopa monnieri, which has shown very impressive results when tested against dementia medications in one-on-one or head-to-head studies. Bacopa monnieri actually has shown very, very good results in helping to preserve or reverse early memory loss and preserve memory as people age. And the adaptogen herb known as ashwagandha that some people use for stress has also shown promise in preliminary research as a supplement that can reverse mild cognitive impairment. And we have about 3 different clinical trials now where people with mild cognitive impairment, which is the first step towards Alzheimer's disease, using 3 to 9 milligrams of melatonin 1 hour before they go to bed has reversed that memory loss problem in a high percentage of the patients that were in the group given the melatonin versus the placebo. So the prevention of dementia also entails keeping your blood cholesterol in the ideal range to prevent cerebral vascular disease. That's where your blood vessels clog up with cholesterol and you can't get blood and oxygen flowing to the parts of the brain. That'll cause dementia. So you need to keep your cholesterol in the ideal range. High cholesterol is never a good thing, of course. And you also need to avoid head injuries and head trauma. This is very important in the prevention of dementia-type problems over your lifetime. So wear a helmet, try to be careful with high-risk collision situations. So the bottom line is that diet and lifestyle are key factors in the prevention of dementia and in many cases of Alzheimer's disease. So I would encourage you to be proactive and protect your brain, use your brain, and feed your brain the nutrients that help to keep it healthy and functional. Now, I've included a link to the cited research in the text below if you want to read further. So thanks for watching, and I will see you next time.